Welcome. My name is Dr. Eliana Ramirez. I am the director of the Crisis and Recovery Enhancement CARE TA Center. I am so excited that you're joining us today. I'm going to be co-presenting with the amazing Ayana McGee. Good morning, Ayana.
Good morning, Eliana, and good morning, everyone. Thank you so much for being here. As Eliana had mentioned, my name is Ayana McGee, and I am the Associate Project Director with the CARE TA Center, she, her pronouns.
Thank you so much, Ayana. And welcome to everyone. My name is Eliana Ramirez. I use she, her pronouns, and I am connecting to you from the Bay Area. This is land that was originally cared for and unceded by the Ohlone. The Ohlone are a community who are vibrant and doing so many incredible community organizing, both in the East Bay and on the peninsula of the Bay Area. And I welcome you if you know whose ancestral lands you are currently on. If you would add that into the chat, it would be great for us to get to know each other, but also the people who originally cared for the land that we are on. So welcome to Keeping It in the Community, the power and role of collective hope and action for crisis recovery. Visibility matters. We hope you will see yourself as behavioral health providers, Black, Indigenous, and other people of color, LGBTQ plus people, people with lived experience, dreamers, builders, and boundary breakers, reflected throughout this conference. We know that the power of hope in 2022 is born of our collective action. Our recovery from ongoing crisis and disasters is enabled by our collective action and the wisdom of our culturally defined practices just as much, if not more, at times than our evidence-based practices. Welcome to the 2022 Virtual Care Conference. We want to start off by saying Happy Pride. We are in the very final hours of Pride 2022. And when we say Happy Pride, we wish that we may all be safe, loved, and respected for 12 months of the year, of every year. And I will invite Ayana to step in for the next several slides.
All righty, and Happy Pride to everyone. So first of all, we're just going to kick us off with a brief disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect those of our funder, the California Department of Healthcare Services, or our CARE TA Center partner agencies, all listed below. So learning objectives for this brief welcome session. First, just welcome in. Hello, and thank you so much for being here. We're so appreciative to be sharing space with you this morning. So we'll run into an orientation to the conference agenda and socio, and then we'll talk a little bit about crisis continuum of care and disaster response and the intersections therein in 2022. Now, what is CARE? Okay, so the Crisis and Recovery Enhancement TA Center provides training and technical assistance services to California's Mental Health Services Act funded stakeholders and partners to strategically plan, effectively implement, and continually evaluate and improve their behavioral health coordination and crisis response. And specifically, we look at racially trauma-informed approaches to crisis care that honor our cultural wisdoms and lived experiences with a focus on healing outside of institutions such as hospitals, jails, and prisons. The CARE TA Center team is made up of these phenomenal partner agencies, including, of course, Center for Applied Research Solutions, RI International, NAMI, the National Alliance on Mental Illness, California chapter, C4 Innovations, Impact Justice, specifically their Research and Action Center, and then Stanford Sierra Youth and Families. So you'll see all these folks throughout the sessions today. We're so grateful for their contributions to this conference and the overall project. Next slide, please. So the CARE TA Center has multiple components. This includes listening sessions that we do throughout the year to hear from community about what's working, what's not working, strategies and best practices for delivery of crisis care and justice diversion programming. Of course, we provide technical assistance, and you can request that assistance on our website. We have an awesome, robust resource library. And then we send out on a quarterly basis a newsletter. You may have seen that if you're on our listserv. And then, of course, we have social media channels that we are happy to connect with you on. So please do connect with us on Facebook, Twitter, or Instagram. And then we have Cafecitos and 5 Things Digest. And I do want to dive a little bit deeper into some of the resources and assets that we have available on the CARE website. Of course, this is care-mhsa.org. That is our website where you can check out these resources. And so we've intentionally developed, for example, our California County Crisis Continuum Asset Map. And this map lists out MHSA-funded programming across the state in every county, programs related to crisis care and justice diversion. And so if you're a county agency or you're a community-based organization looking to get connected and see what's available in your county, perhaps you want to connect a client, or perhaps you want to improve your services and you're looking to see what are other folks doing, what's working well in other places, and how can I learn from them? That's a great place to go to as a resource. And of course, we do this all with a systemic approach, as I mentioned. And so we always want to encourage that peer learning. Also notice I mentioned the resource library. That is a very fantastic and robust library with over 400 or so, maybe even 500 now, but over 400 resources dedicated to crisis care and justice diversion, and specifically looking at diverse communities and cultural experiences, and looking at what community defined practices, what community or culturally responsive practices are most responsive to community needs. And so, for example, we have the California Pan-Ethnic Health Network, their concept paper that they developed, I want to say in January of this year. Fantastic, phenomenal paper. I recommend everybody read that, but it talks a lot about how we acknowledge and emphasize the importance of culturally defined practices that are based in culturally responsive healing. So everybody feel free to go to the resource library and check out those resources. Next slide. And we also want to point out that we have a California County Crisis Continuum stage of implementation map. And again, as I said, we always want to emphasize systemic change and peer learning. And so if you're a county agency or a community-based agency, or a community advocate, you advocate for someone, a loved one who receives behavioral health services, this is a great way to see like what's out there, what's working, what's not working, where are these different programs at in terms of their stage of implementation. Perhaps you're interested in a crisis line or a mobile crisis unit, and you want to know, like, are they expanding right now? Are they going to be doing more? How can my program match or align with some of the efforts that are happening across the state, or what can I learn? So definitely recommend that you go on to the website, check out the stage of implementation map, and see what's going on in California. We're doing great work out here. You all are doing amazing work out here. And so just thank you all for the everyday work that you do. And we hope that these resources will be helpful for you as you continue on in your journeys. Welcome everyone, wherever you're coming from. We're just so grateful to be here with everyone, and bringing in everybody's different experiences and cultural realities into all the different contexts that we're going to be talking about today.
So we approach this work from a racially trauma-informed approach. On the right-hand side, you see the SAMHSA Trauma-Informed Principles, Substance Abuse Mental Health Services Administration. On the left-hand side, you see the ways that we strive within the CARE TA Center to manifest these principles, but not just the trauma-informed principles. We also refer to Ginwright's 2018 Future of Care, shifting from trauma-informed care to healing-centered engagement. So throughout the rest of this day, we will be giving you content heads up about heavy content. And this is so We encourage safety and transparency. If at any point in time you feel activated by what's happening in the session, you want to step away, if you feel overwhelmed with emotions or just want to get away from the content for a little bit and you want to seek some safety and utilize choice, we invite you to go to our Feel It to Heal It room. Inside the Socio Conference platform, there's a tab on the left-hand side that says Feel It to Heal It. This is a self-directed room where you can access a variety of music videos that will help to move through the whatever emotions, experiences you are having. But there are also these self-help, socially distanced resources that you can utilize. There's also a self-care guide, a workbook. If it would be useful to you, we welcome you to use that. We use musical interludes throughout the conference and encourage you on breaks, of which we will have 30-minute breaks between each session. We want there to be ample time for you to get some water, stretch, eat food, and to take some time to check emails if that's something that you feel like you need to do. But we do encourage you to try and stay present with us during the content portion of these sessions. In between the learning events, we invite you to go to our Feel It to Heal It YouTube mix, where you will find a variety of music videos that are really based on empowerment, cultural strength, and historical approach to thinking about where we're at today and what we're getting through. It's important that when we talk about behavioral health disparities, that we also talk about the incredible resilience that our communities have. LGBTQ people, Indigenous people, we know a thing or two about surviving pandemics. Japanese American people and Black Americans, as well as Mexican ancestry people, these are communities that have experienced very significant things from internment camps to chattel slavery to current contemporary migrant detention facilities. We know a thing or two about surviving systems and coming out the other side able to transform them as well. So crisis continuum of care is a term that's oftentimes shared out there. And this is what it means. We have put together this infographic drawing from, on the top left-hand side of your screen, you can see guiding values. These come from SAMHSA. Beneath that, there are values from the peer movement, people who are consumers, survivors, activists with lived experience. So we've brought together these two value systems and created this infographic, which starts with the idea of wellness and recovery at the bottom and stabilization. We wanted to have a person-centered model drawing from the peer movement. And we have a little person's head and shoulders down here. This is us at any moment in our lives. If we start to have a hard time on a day, we might need to reach out for some support. We first might try and do something on our own at that person-centered level where we have maximum personal autonomy. It might be me picking up my elderly and very vocal cat, or it might be me listening to some of my favorite music. But if that's not enough, I might need to reach out to someone. I might call a warm line or a crisis line, or I might reach out to a mental health provider who's outpatient in the clinic. At any point, I might need to reach out a little bit further. Maybe I call that crisis line, and the crisis line determines that it would be helpful for somebody to come and see me in my home or in the community, or if I happen to be under a bridge or at school, that mobile crisis team can come and meet with me. And that mobile crisis team might determine that I actually do need to go somewhere else for a little bit more stabilization. They might take me to a peer-run crisis recovery center or a short stay at a crisis residential service. It might be that I need a little bit more support than what happens in the community. In the community, this is where I'm semi-autonomous because it's me making decisions, but I'm also making decisions with a provider. When we start to go out to that furthest level out, that's when we start to think about institutional crisis intervention. This is where people have the least autonomy. Now we're starting to talk about inpatient hospitalization. We're talking about forensics within juvenile and criminal legal systems. In between those two worlds, you see that there are peer supports who would visit in a hospital or other institutions. And there's also a crisis intervention team that's a co-response model with law enforcement and behavioral health providers. The CARE TA Center, our whole purpose is to help people who are experiencing behavioral health crises like suicide, overdose, intimate partner violence, racial hate crimes, to recover in the community, where we have the most personal autonomy, where we tend to have access to supports that are most culturally responsive. Because as we start to go into emergency rooms, hospitals, certainly in jails and prisons, that's when we can be re-triggered, we can be re-traumatized. These institutions are super expensive, and they oftentimes will just add on layers of stress rather than helping us to slow down and calm down and get settled. Because as Maya Angelou says, every storm eventually will run out of rain. Here you see these orange human symbols coming up. This is for the Mental Health America Chinese Communities Orange Patrol. They are a group of people, volunteers in Oakland, California, many of whom are older adults who they don these orange vests and they walk through the streets of Oakland, interrupting anti-Asian hate crimes. They are literally protecting their community on the street because, as you might be aware, the rates of anti-Asian hate crimes have skyrocketed. BEAM, the Black Emotional Mental Health Collective, they are amazing, located in California, but they serve the African diaspora worldwide. They just got back, many of their staff just got back from Buffalo, where they were providing community-defined and evidence-based practices to survivors of the mass shooting incident at the grocery store. So when I talk about the power and collective hope and action for recovery through the many crises that we're facing, I'm especially thinking about people like MHACC and BEAM. And I'm thinking about all of you as we continue to move through this world together. Now, for this crisis continuum of care to be most effective, we need ample communication between each part of these systems, right? We need, in the bottom right-hand side, assessments that are culturally responsive, and communication and peer specialists who are moving with us across these different layers of support, from the individual to the community to the institutional, and then back again. On the left-hand side, we need evidence-based practices like suicide safety plans, wellness recovery action plans, and psychiatric advanced care directives to follow us through each of these different places along the continuum. So the entire idea of this conference today is acknowledging that historically, the crisis continuum of care and disaster response have been thought of as two separate streams. If you look at the training, if you look at the funding, if you look at the resources that are requested by community and the resources that are shared back to community, there's a big difference historically between what a national crisis suicide prevention line provides and what the Red Cross provides when they land in a community, say following Katrina or another natural disaster. But increasingly, we're starting to see that those two streams are actually coming together. We're seeing it in funding, as well as the kinds of resources that are being requested and shared out. Later today, I have a session that's talking about social work practice at that particular intersection, and we have an entire learning track that's focusing on crisis continuum of care and justice diversion at the point of disaster response. And this is a theme that's run through all of our learning as well. Another theme that's run through our learning is always focusing on how are these different disasters like the COVID-19 pandemic impacting the most marginalized, historically underserved amongst us. In California, we know that people who come from low-income backgrounds, Latinx folks, Black folks, Pacific Islander communities, as well as essential workers like those of us who are in healthcare, work in grocery stores and cleaning services, are bearing the highest brunt of the COVID-19 pandemic. You'll have access to all of these slides, so I'm going to go ahead and move through them fairly quickly because I want you to have ample time to hear from Nakaya. So this slide is talking about the pandemic impacts, and of course they're doing some yard work now, so I'm going to close my window, but I'll keep talking to you for a second here. Not just in California, but across the nation, we are seeing that certain communities are having really high, especially high impacts from emotional, socioeconomic perspective and wellness perspective, again, in general. We see that 167,000 children have lost a parent or caregiver to the virus. 63% of people who responded to report, a study on stress in America, said that their life has been forever changed by the pandemic. 42% of us have relied on unhealthy habits to get through the last 2 years. And I don't say that in a shaming way at all. What happens, how many of us were told how to get through everything that's going on right now? None of us were, right? We're all just kind of figuring it out. We're building this plane as we go. And sometimes that includes choices that are detrimental ultimately to our health, such as drinking. There's been an increase, 23% during the pandemic, just to cope. Wildfires in California, they are raging. And so we're not even fully through 2022. And you can see that we're almost at the same number of fires that we had last year in 2021. As of June 8th, there have been over 250 mass shootings across the United States just in this year alone. It's averaging 4 mass shootings a week in 2022. And we're seeing that the rates of suicide, suicidal crises, and deaths related to suicide are significant. In 2020, the National Suicide Prevention Line received 2.4 million calls. 304,000 of them were from California. That's a 67% increase in the California Lifeline volume since 2016. When we start to look at very particular communities, we start to see disparities in health and differences that are related to things like racially traumatizing situations that are happening on an individual level and a social level. And this is where we're starting to diverge from trauma-informed to healing-centered engagement. So when we take a healing-centered engagement approach, we start to think about the impacts of George Floyd's murder on Black Americans. We've seen an increase in anxiety and depression from 36 to 41% following George Floyd's murder. We're seeing suicide higher among Black boys 5 to 12 years old than their white peers, increase in Black suicide, adolescent suicide attempts among Black youth between 1991 to 2017. That was before the pandemic, that was before the killing of George Floyd. And these numbers are just continuing to go upward. We see a number of barriers to care. The distrust and implicit bias by medical providers cannot be overstated. I spoke to a colleague yesterday who works with Beam who had been out in Buffalo. And what she shared was that when they started a talking circle, one of the people who was a survivor from the Buffalo mass shooting incident said this was the first time she had left her home since that incident. And she was not going to go into the local behavioral health department because she could not meet with a white or non-Black provider. The importance of us hiring and retaining people of color in the workforce, especially the behavioral health workforce and medical workforce, cannot be overstated. But this story, let's also remain focused on how incredible it is that Beam is in existence, that Beam is here to fly out to Buffalo to provide community-defined and evidence-based care that would finally help that woman to feel safe leaving her home. When we look at Latinx mental health, so these are Latino, Latina, Latine people, we see very high rates of declining mental health among Latino youth as compared to white peers. But when we then look from an intersectional perspective and look at Latino LGBTQ people, we have an even higher experience of generalized anxiety symptoms. There are differences in suicide attempts, but we're seeing them especially high among Latina high school students. Latinos, Latine people receive mental health at a lower percentage than the rest of the population of the United States. And there are several barriers to care, such as not knowing what the signs are of mental health challenges. There's fear of judgment and or fear of deportation, that if I am experiencing a behavioral health crisis, if I go and call somebody a crisis line, and if I am undocumented, does that mean that I could end up being deported? Or if my family member, maybe I have citizenship, but maybe my family member doesn't. I'm in a mixed status family. That might be another barrier. But there are also other barriers, religious barriers, ideas that we should pray it away, poverty. There are cultural factors like La Toxica, the idea that there are some people who just have parts of their personality that are known to create behaviors that are aberrant behaviors. Or there's machismo, this idea that men are supposed to be strong and resilient providers and not access care. On the flip side of that, the idea that women are to care for the home and the family with minimal time for their own self-care. But here we have Latinx therapy. They're providing free therapy in English and Spanish to help the people, the victims, survivors, and community who are in Uvalde for that recent mass shooting as well. When we look at Asian mental health, as I mentioned previously, look, this is a 177% increase in anti-Asian hate crimes in California in 2021. There have also been mass shooting incidents specifically targeting Asian ancestry people, such as the March 16th, 2021 shooting at a spa in Atlanta. We know that societal oppression and violence becomes internalized into self-hatred and can become self-harm and ultimately lead to self-directed violence and suicide. And right now, suicide is the leading cause of death among Asian American youth, ages 15 to 24. But as I mentioned before, we also have the Mental Health American Chinese community and the Orange Patrol, and you've got to check them out. If you don't know them, they are amazing. And they're literally walking the streets of Oakland, keeping the community safe, intervening not only on hate crimes, but also helping people who are experiencing behavioral health crises on the street. People, we can and are doing the work to care for ourselves, even if government might be a little slow, even if the science might be a little bit behind the dates, even if there isn't funding available, even if we're dealing simultaneously with a pandemic and wildfires and a recession and all of the other things that are going on, our communities are gathering together and we are helping one another. But it's coming at a cost. Prior to COVID-19, 21 to 61% of mental health practitioners were reporting burnout. In 2022, we're seeing 78% of psychiatrists reporting burnout. And in one study of college counseling practitioners, 90% identified themselves as experiencing burnout. So I want to take you into this as my final ending here, and then we're going to get to Nakaya. And I'm going to ask us all to take a few moments to give Nakaya a little extra space, and maybe we'll just shorten all of our 30-minute breaks just down a little bit over the course of the day so that we can have adequate time. But I want to give a huge shout out to Humboldt County, Marin County, Orange County, Riverside County, Santa Clara County, and San Mateo County. In every one of these 4 or 5 learning tracks that we have over the course of this day, we have people from county behavioral health departments, as well as community-based organizations locally to California, who are going to be sharing with you the best practices of the work that they're doing. I can't say highly enough how much gratitude I also have for Dr. Joyce Chu out of Palo Alto University and Santa Clara County, who worked with her team to develop Be Sensitive, Be Brave. Okay, I'm speaking directly to the ethnic services managers, MHSA coordinators, and suicide prevention coordinators who are here with us. If you are looking for a extremely low cost and evidence-based suicide prevention training for your community that can be tailored to your specific diverse communities locally, please check out Learning Track 5. You can actually watch and participate in the Be Sensitive, Be Brave, Suicide Prevention 101, and Mental Health 101 trainings that have been rolled out in Santa Clara County, San Mateo County, and Humboldt County already. You can also hear from the amazing Dr. Joyce Chu herself. Finally, this is some of the guidance that informs our attention to this work. And I just want to highlight, as a transition into an amazing presentation by Nakaya Lynch, going back to our crisis intervention continuum of care, look at, please, those orange or gold colored buildings. These are the specific kinds of services and resources that are available for transition age youth and younger children who are experiencing the foster care system across the lifespan of their youth and early and transition age into adulthood. And with that, I am so grateful and honored to bring to you the amazing Nakaya Lynch, who is joining us today. I'm going to ask that, there they are, Nakaya, welcome. Good morning, or good afternoon, you're on the East Coast. I'm gonna ask if the incredible Stephen could please bring up Nakaya's slides. And Nakaya, take your time with this. Thank you for your adjusting to us and our time thing. And with that, I will say, Nakaya, welcome.
Thank you so much, Eliana. It's an honor to be here. I'm very excited to speak with you all. So thank you all for having me and for granting me this space. And with that, I guess we can just get on started. If we could go to the next slide, please. So this is just some disclaimers. The views and opinions and the content expressed to this presentation do not reflect those of the funder, the California Department of Healthcare Services, or CARE TA Center partner agencies listed below. Yeah, they're all my opinions. So I'm the one that made the presentation. It's me. If there are anybody that you disagree with me, it was me. And the next slide, please. So hi, my name is Nakaya Lynch. I work at the Human Rights Campaign as the Youth Engagement Specialist. Well, Youth Wellbeing Coordinator specifically. And I'm excited to be here with you all. Next slide, please. Just a little bit about me. I'm a foster care alum. I've been involved with advocacy since I was 17. I'm from Prince George's County, Maryland, and identify as a non-binary lesbian. And a little fun fact about me is that I make my own feminist t-shirts and wired earrings. I just felt the need to add that to you all to just, spice it up. We're going to be talking for a little bit, so I thought it would be fun to have a little fun fact. A little bit about me. Our learning objectives for today, we're going to learn about LGBTQ plus allyship 101. So just some basic terms and concepts you should be aware of when it comes to learning about the LGBTQ plus community. We're going to learn the importance of LGBTQ plus youth allyship, and we're going to learn how to implement youth voice into your work. Okay, so I guess we can go ahead and get started. Thank you all for attending this event. You being here is inherent proof that you see the urgency behind the needs of this vulnerable population and the importance of meeting those needs. In order to truly rectify the way that we fail the LGBTQ population of youth in foster care, we need to come together and implement real systemic change within the institutions of child welfare. It is my belief, my personal belief, that what these youth really need is the complete abolition of the current child welfare systems. The child welfare system causes too much harm and cannot continue in its current iteration. We need to start over. The current issues the system faces, an example, families losing their children due to not being equipped to support them, while those children go to other families that the state provides that support to, or underfunded and overcrowded group homes, programs that can actually benefit youth repeatedly losing funding, and social worker turnover and burnout are all part of a cycle of re-traumatization that no child deserves to be exposed to. But unfortunately, true change in the form of abolition is unlikely to happen within any of our lifetimes. What we can do in the meantime, however, is listen to these young people and let their voices be the guiding principle behind any and everything we do to serve them. During our time together, I plan to show you different ways you can begin doing exactly that, integrating youth voices into youth-serving work. Hopefully, you'll learn exactly how life-saving this work can be and leave with the more confidence in your skills as an LGBTQ plus youth ally. So let's get started with some LGBTQ plus 101. I'll start by telling you a little bit about me and why I'm an expert in this work. My name is Nakaya Lynch. We already know that. My pronouns are they, them, theirs, and I'm a 23-year-old foster care alum and a non-binary lesbian. I'll get into my story and experiences later, but for now, let's cover a bit of LGBTQ plus 101. What do those terms mean? How can you be both non-binary and a lesbian? Let's find out. The identities within the LGBTQ plus community can be broken down into two main groups: gender and identity and sexuality. The LGB portion of the acronym, which stands for lesbian, gay, and bisexual, falls under the sexual orientation umbrella. The T portion falls under the transgender umbrella, and the Q part can fall under either, depending on the person. Now for some basic terms and definitions. Lesbian refers to a woman exclusively attracted to other women, or a non-binary or gender-expansive person exclusively attracted to women. Gay refers to a man exclusively attracted to other men, or a non-binary or gender-expansive person exclusively attracted to men. It can also be used as an umbrella term to describe the broader queer community. So for example, if I wanted to say I was gay instead of saying I was a lesbian, I could do that. Bisexual refers to a person of any gender who is attracted to multiple genders. Transgender refers to someone whose gender identity does not align with the sex they were assigned at birth. So for example, a non-binary person who was assigned male at birth, or a man who was assigned female at birth. Queer refers to someone whose sexual orientation or gender identity falls outside of what could be considered cisgender or heterosexual. And if you're wondering what cisgender means, cisgender refers to someone whose gender identity aligns with the sex they were assigned at birth. A boy who was assigned male at birth, or a woman who was assigned female at birth. So cisgender is just the opposite of transgender. The gender binary refers to a system of gender classification in which all people are categorized as either being male or female. Next slide, please. Next slide, please. Oh, did it go? There we go. Okay. So this is a little person that can help you remember more about the LGBTQ+ acronym. So sexual orientation is who you love, gender identity is who you are, and gender expression is how you do gender. So my sexual orientation is a lesbian, my gender identity is non-binary, and my gender expression apparently today is a striped sweater. Next slide, please. So a common mix-up people encounter when first venturing into the LGBTQ+ allyship is conflating or confusing gender identity and sexual orientation. Gender identity refers to who you are, while sexual orientation sometimes refers to who you are attracted to and how you are attracted to others. When talking about transgender identities, there are two main categories under the trans umbrella that these identities can fall into, those categories being binary and non-binary. A trans woman or man, oh, you can go back. Thank you. So this is just like a little infographic I made myself. Graphic design is my passion. That was a joke. It's not my passion at all. But as you can see here, there's just different examples of identities you can hold on to while being non-binary or being a binary trans person. And then if you could go to the next slide. Thank you. A trans woman or a trans man would be considered a binary trans person. This just means that their gender identities fall within the spectrum of the gender binary. A trans non-binary person, however, has an identity that doesn't necessarily fall within that spectrum. Some non-binary people lean closer to masculinity or femininity, and some don't. It just depends on the person. I personally like to joke that I'm a woman the same way a tomato is a fruit, and I'm a man the same way that Tweety Bird is. Technically, but not really. Just a little humor for you. To understand these identities better, let's consider this metaphor. Think of the gender binary as a clothing store that only offers either extra, extra large shirts or extra, extra small shirts. While these options may work great for some, many people find that they simply don't fit, and that's okay. Now, while I hope you're able to retain as much as I'm saying as you could, I acknowledge that what I've just said is a lot, but I think remembering the number one rule of LGBTQ+ allyship can help you even if you can't necessarily remember everything I've just discussed. That rule being, you don't have to keep up, you just have to keep open.
Imagine you are filling out a form at a doctor's office or on a job application. What options do you have when indicating your gender? Or imagine you're a parent filling out paperwork to enroll your child in a new school. What fields are provided for you to describe your relationship to the child? Oftentimes, we are only given the option to choose either male or female to identify our gender. On other forms, we may be forced to identify ourselves as a mother or a father, even when those options don't work for us. These are examples of how the gender binary forces individuals to choose from only two options, male or female. So, what is the gender binary? The gender binary refers to the traditional belief system that people are either male or female. And once we know whether someone is male or female, a whole host of assumptions follow. According to the gender binary, if you are male, that means you were assigned male at birth. Your gender identity is male. You are masculine and you are only attracted to women. Similarly, if you are female, the binary view of gender tells us that that means you were assigned female at birth and identify as female. You are feminine and you are only attracted to men. Yet, we all know people whose experiences fall outside of this strict view of gender, whether personally, professionally, or from popular culture. Can you think of someone whose experience does not fit perfectly into one of these descriptions or the other? This binary understanding of gender creates barriers for those whose experiences and identities are outside of it. How does this happen? Like other systems of oppression, the gender binary is embedded in our laws and policies. It shows up at the institutional level and on the interpersonal level. We see it on forms, on bathroom signs, in clothing and toy stores, and in how we speak to others. It's there when we ask a pregnant person, is it a boy or girl? And when we ask a teenage girl if she has a boyfriend. Despite our best intention to build a connection with her, assuming she'd be interested in boys may have the opposite effect. Perhaps she is gay, bisexual, or questioning her sexual orientation. The reality is, most biases and stigma faced by LGBTQ+ people is rooted in the gender binary. Unlearning this limited view of gender is a necessary part of creating a more fair world. Similar to how many of us have messages to unlearn around white supremacy and racism. In fact, the gender binary has roots here too. Colonizers labeled the gender diversity of indigenous communities as inferior, dehumanizing indigenous people to reinforce white supremacy. The knowledge of how entrenched systems of oppression are in our history and culture can sometimes make it seem impossible for change to happen. But it can. We can be intentional and intersectional. We can recognize that all of us hold multiple, intersecting identities. We can ask questions to deepen our understanding. This will help us create environments where everyone can share their authentic selves. It just requires thinking about things a little differently and identifying those practices that need updating so we can be as affirming and equitable as possible. The gender binary and systems of oppression may be rooted in history, but we don't have to carry them into our future. It starts with you.
Remaining open to learning about multiple identities and remaining teachable is important to allyship in all regards, but especially LGBTQ+ allyship. While you may not always be able to understand or relate to someone's identities or experiences, you should remain willing to learn and listen. Now, you may be thinking, this sounds too complicated. Why even bother trying to understand? Well, don't just take it from me. Let's look at some statistics. According to a 2021 study done by the Trevor Project, LGBTQ+ youth who have been in foster care were 3 times more likely to attempt suicide within that year. The compounding pressure of experiencing the child welfare system, dealing with homophobia and transphobia, and other intersecting marginalized identities can prove to be too far heavy a burden for children to bear. Next slide, please. A 2022 study by the Trevor Project found that 45% of youth considered suicide within the past year. But the survey also found that the youth who reported living in a somewhat accepting community, only 13% attempted suicide. That's a huge difference. If living in a somewhat accepting community can drop suicidality amongst LGBTQ+ youth from 45% to 13%, imagine what having people in their lives committed to active allyship can do. Next slide, please. LGBTQ+ youth in foster care fight a daily battle against the oppressive system of child welfare and the oppressive structure of a heteronormative patriarchal society, compounded on top of whatever other marginalized identities they may possess. Being a person of color, having mental illness, having a disability, the list goes on. These constant struggles can lead to feelings of hopelessness and despair. At least they did in my case. My mother passed away when I was 12 years old, and afterwards I was sent to live with my evangelical Christian family. After I was outed to my family the first time, I was admitted to the child welfare system and sent away to a group home. My family convinced themselves that my sexuality was a part of some sort of rebellious behavior or mental illness, and that I needed more help than they could provide. This was evangelical code for "we cannot control you, so you have to leave." In my first group home, I wasn't allowed to attend public school as part of the group home's program, so I missed an entire year of schooling my sophomore year of high school. There was a school program at the group home that consisted of residents being handed elementary level worksheets to complete within 3 to 4 hours of the day every day. One of our worksheet assignments contained a story about Oprah. It was a summary from her autobiography detailing the years of abuse she faced, the ways she struggled, and the hardships she faced before becoming the Oprah we know today by her 40s. Sometimes the only thing keeping me going was the idea that one day all of my problems I faced in the present day would someday just be a blip in my autobiography. I still have yet to write one, but when you first enter the system, they work with your family to decide what your permanency plan will be. There are 2 types of permanency plans. One is a plan with the eventual goal of reunification with your family, and the second one is with the goal of complete independence. As far as I knew, my goal was eventual reunification. My family dangled the hope of returning home over my head, always somewhat out of reach. All I had to do was become the exemplary Christian girl they wanted me to be. Couldn't be that hard, right? Well, as I'm sure you could guess, it wasn't that simple. I was in that group home for 3 months and spent my 16th birthday there. My family rarely visited me or called me during my stay there. Through my time away from my family and with my peers, I started learning how big and complicated the world was outside of my former sheltered life. Sometimes that was through late night conversations with my roommate, giggling about our crushes and our dreams, and sometimes it was through witnessing the most horrendous act of violence I'd ever seen in my life between 2 girls fighting over ramen noodles. The experience taught me a lot of things, but most of all, it began sharpening me. Instead of learning how to be who my family wanted me to be, I started learning who I really was. After 3 months there, it came time for my family to decide if I was ready to come home, and they said no. So I went to another group home, this time one out in the countryside in a wealthy majority white area. I began attending the local high school there at the end of my junior year. I spent over 6 months without being enrolled in school because there was an issue at the Department of Social Services in transferring my paperwork. So I was now about 2 years behind my peers academically and expected to keep up. My teachers were unsympathetic to my situation. Most of the staff working at the school resented the group home girls, as they called us, intermingling with the student population. They saw us as troublemakers who didn't take their education seriously and as people beneath them who didn't belong there. I ended up needing summer school. My senior year of high school, I faced a lot of pressure. I was dealing with bullying, racism, and the realization that I only had until the end of the summer to be that perfect girl to be reunited with my family. Black Lives Matter's protests kicked off in Baltimore. Police violence continued to plague the city. Trump was elected into office, and I couldn't stop being gay no matter how hard I prayed. I began feeling a slow sense of doom, and soon I began accepting it. I closed myself off from the world and from hope itself. After I graduated high school, I had a final home visit with my family over the weekend. That Sunday, my aunt asked me what I got out of church, and I told her I didn't get anything out of it. She asked me why, and I started crying because I knew that my time was up. I'd only had one goal this entire time, and I'd failed. I came out to her a second time, and she told me I could either work with the church to fix it, or I could go live in a world without my family. Later that afternoon was my graduation party. I was surrounded by people I hadn't spoken to in years on account of being away for so long. They were my family and friends of my family, but they felt like total strangers. And I realized as I looked around that that's who I'd become to myself if I were to stay, a total stranger. I made my decision, and within a couple of months, I was placed in my first and only foster home. By this point, I was on my third to fifth social worker. As your case evolves, and sometimes just due to high rates of turnover, you change social workers a couple of times in the system. It stopped bothering me after a while because I simply learned not to get attached to anyone. It was easier that way. It was easier that way, my bad. A little bit of word stumbling. I went through most of my life feeling as though I was stuck at my graduation party, drowning in a sea of strangers. They'd come and go, and we'd have visits in between. They'd ask me how I was doing, and I'd always say fine. They'd ask me what my goals were for the future, and I'd always find a way to dodge. In my evangelical family, you were discouraged from going to college. It would cause you to brush elbows with people with too many ungodly beliefs. You were supposed to find a job, you could work part-time so you could dedicate most of your time to the church, and eventually move out when you got married. So every time I showed interest in a subject or a hobby as a child, I was shot down. I wasn't even allowed to take AP classes. And as the feelings of hopelessness coursed through me, I became less and less sure of whether I'd even have a future. But that was all about to change. Next slide, please. Apologies, I realized as I was reading through my speech that I forgot to cue the slide, so we're a little bit behind slide-wise. You don't have to play the video yet, but thank you. The last social worker I ever had took me on a seemingly regular outing during our visit. We got fast food, chatted a little, and that was about it. But right before I got out of her car, she remembered a worksheet for me to fill out. It was for a new support group in the department. She asked me, "Are you a part of the LGBTQ+ community?" And I lit up. It was the first time any of my workers had asked me this question. I told her yes, and explained my sexuality and pronouns to her for the first time. She handed me the worksheet, a questionnaire on your identity, and told me there was a new program at the department. It was a support group for LGBTQ+ youth, and I didn't know it then, but it was about to save my life. I attended with no expectation, but for the first time, that flutter of hope I once knew returned to my stomach. I met peers who shared similar experiences to my own, who complimented my wacky outfits and used my correct pronouns. I felt seen, and while that was wonderful, what I witnessed next was truly life-changing. Openly Black LGBTQ+ identified social workers living their lives casually and showing up to run groups for us young people. They casually mentioned their partners, related to our experiences, and helped us understand concepts like intersectionality and marginalization and how to deal with minority stress. They existed and they were successful, and that meant it was possible for me to do so. It was the first time I saw myself represented in a group of people, and it was real life. That flicker of hope became a raging furnace. And with what felt like a whirlwind, my life did a complete 180. Suddenly, I felt confident enough to use my voice, and for the first time, people wanted to listen. I spoke out about my experiences on behalf of my peers at conferences. The department was so impressed with me that they created a position called Youth Engagement Specialist, and they hired me to speak up. I went from support group attendee to support group employee within a year. Through my work with the support group, I became partnered with HRC's All Children, All Families program. I soon received training from that program to begin speaking with foster parents, social workers, and community stakeholders about the importance of LGBTQ+ inclusion in state programs. And now I'm going to speak to you about it. And now if you can play the video, please. Take it away, past me.
My mom was diagnosed with cancer when I was 9 or 10. My mother was my best friend. She passed away like a year or two after she was diagnosed. I came back to live with my mother's sister, and then I came out to her, and she put me into a facility.
What we have found is that many children come into foster care because their families are unable and unwilling to accept who they are.
All Children, All Families is a program of the Human Rights Campaign Foundation that provides resources, training, and technical assistance for child welfare organizations so that they can better serve the LGBTQ community.
People who work in foster care need to learn about gender identity, sexuality, all of that. It's life or death. They always feel like, we have to hurry up and house these kids so they don't end up homeless. It doesn't matter if they have somewhere to stay if that person isn't going to be affirming of their identity. You put this queer foster kid in this situation where they have to choose between safety and validation, which are both safety issues.
The All Children, All Families program gives us an opportunity to not just train staff, but to look at our procedures and our policies and our practice. We are hopeful that what we're doing will transform the delivery of child welfare services to our LGBTQ youth.
At the end of the day, All Children, All Families is working towards the same mission as the child welfare organizations that we partner with. We do this work to make sure that no young person feels isolated or alone.
I knew many years ago that I wanted to be a father. I even had names already picked out. Being with him opened me up to be loved and to see that I had love around me.
We decided to open up our lives and our home to foster. When we went into the agency,
I was nervous.
I was nervous. I didn't want to be discriminated against. I didn't know how we'd be received.
We want to recruit people who are going to be supportive resources for our young people, regardless of how they identify.
All Children, All Families helps to bridge the gap between agencies who need more foster and adoptive parents and the many LGBTQ adults who are interested in foster parenting or adoption.
The people that were in charge, they made us feel comfortable.
We went to the training session.
Yeah.
And from there, it was just go, go, go.
With our license, we have the ability to foster and adopt as well.
Mm-hmm.
And so we want to be able to create a family and help create families for them.
We know that agencies want to do better with the LGBTQ community. It takes real intention and buy-in from leadership. It takes policy and practice change, and All Children, All Families offers those resources.
I have met so many caring, good people. Being Black, being queer, being in foster care, all of these things are just such painful things at times because of society. Having foster care workers who know how to handle my case and who know what it means to be LGBTQ and are willing to learn and are willing to validate me means the world.
It's about having a home full of love, laughter, a place where you belong. And I think everybody should be able to have that.
Any work we're doing to create more loving environments for kids in care can help us ensure that all young people move through the world feeling loved and a sense of belonging.
The All Children, All Families program can absolutely help change lives.
Okay. Thank you all so much for all the wonderful feedback on the video. It makes me feel better. It's always a little bit embarrassing to show a video of yourself during a presentation. So, as we were saying, why it's important to you. Okay. Aside from the statistics about how it saves lives and how it saved my life personally, LGBTQ+ inclusive programming is a necessity if we are ever to progress into an equitable society. Let's talk about intersectionality. Intersectionality is a term coined by Kimberly Crenshaw, an American civil rights advocate and a leading scholar of critical race theory. The term is defined as the interconnected nature of social categorizations such as race, class, and gender as they apply to a given individual or group, regarded as creating overlapping and interdependent systems of discrimination or disadvantage. So what does this mean? Intersectionality is about examining and acknowledging the marginalized identities we hold that shape the way we experience real world around us. We all have different struggles, but we also all have different privileges. For example, I am a Black, femme-presenting, non-binary lesbian with ADHD. This means I experience racism, misogyny, and ableism in a world that functions differently from how my brain is wired. But English is my first language, I am able-bodied, and I was born in the country I reside in. That means I unconsciously benefit from structures in place that actively oppress someone with the opposite experience. Why is it important to understand your privilege as much as your oppression? And why should you conduct your activism through an intersectional lens? I'm so glad you asked. Without intersectionality, our activism will be stuck in a perpetual cycle of punching down. In order for some people to gain freedoms, others must lose theirs, which is unsustainable because there's no way of determining who will get left behind next. Aside from the fact that it's important to empathize with and support the equal rights of others, it goes against your best interest not to. LGBTQ plus foster youth and our vulnerable community who benefit from as much support as they can get. But now that you understand the importance of helping these young people and the urgency behind doing so, where do you even start? Next slide, please. And the next slide, please. So, allow me to share with you one rule I keep in mind when doing youth work. Youth-led, adult-guided. I came across this sentiment when I attended my first youth leadership conference, and I've been applying it ever since. To do work that is youth-led and adult-guided, you must integrate youth voice into every aspect of the work you do that serves youth, and let it guide how you execute your programs. To integrate youth voice and let it guide your work means to always have youth voice in the room. I found that child welfare system operates on quantitative instead of qualitative data. This means that the funding the programs receive revolves around how many youth are served instead of how it benefits those youth. This leads to an endless cycle of youth-serving professionals with good intentions, starting programs for youth, struggling with outreach or attendance, and youth losing those programs because of budget cuts. Most people would look at the example I just gave and think the youth are at fault. After all, it was the lack of youth attendance that led to the budget cuts, right? No. This mentality only perpetuates the cycle further. As we've already seen, today's youth are going through a lot. This past fall, the Attorney General declared the state of youth mental health a national crisis. And that's the state of youth in general, not even focusing on marginalized youth in specific. So it's safe to presume that LGBTQ plus foster youth are battling even more. Being a foster youth is an identity in and of itself. People who have experienced the child welfare system are victims of specific types of systemic oppression, and the LGBTQ plus youth experience that system completely differently than their cishet peers. Next slide, please. When coming out in states without gender and sexuality-based discrimination protection, they face the risk of being separated from their siblings or peers, placed in housing that isn't gender-affirming, an example being a trans girl, but being placed in an all-boys group home, or even being placed in homes that allow practices of conversion therapy. The best case scenario in these situations is that they get placed in multiple different homes throughout their time in foster care until they're able to just age out. Next slide, please. As someone of this experience, I can say I wasn't always able to attend the support group that saved my life for numerous reasons, most of them centering around finding reliable transportation. And I was lucky to only have to deal with that. I saw my peers disappear and reappear in the support group throughout the year for various reasons. They couldn't find a job, they couldn't find a ride, they couldn't find reliable childcare for their babies or their siblings. They had to work, they had school, they had after-school programs, or even the weight of the world made it hard for them to leave the house. The list goes on. But that doesn't change the impact that that program had on all of our lives. Just knowing it existed gave me enough motivation to see a reason to keep going, let alone the difference actually made by me attending. Sadly, I ended up applying for my gentle time check. Sure, sorry, reading a time check. So sadly, I ended up applying for my current position at the Human Rights Campaign because that program I love so much lost funding. People only cared about the numbers instead of the impact, and now instead of working with youth to gain more attendees, there's nothing for them to attend at all. Some of you may be wondering about the youth who just don't want to attend programs like that or take advantage of the resources the state has to offer. And the answer is the same. Youth lose trust in the department every time they decide to care about something, it gets taken away from them. Maybe they didn't attend the program you hosted because the last group they attended ended abruptly due to loss of funding, and they decided there was no point in trying anymore. LGBTQ plus foster youth are used to that sense of loss. They come out to their parents and get rejected. Now they're in foster care. They get a social worker they trust and their case changes, or the worker leaves due to turnover issues. And now they have to meet another worker and build that relationship all over again. They make friends in their group home, and now they're being transferred to a foster home. I could go on and on. The point is dealing with that constant feeling of powerlessness is tiring. So they decide maybe they can't control any of that at the time being, but they can control if they attend that program their worker suggested, and they take what they can get, and then they don't go. Then it loses funding, and the youth that now wanted to go have to deal with that same sense of betrayal. It's a vicious cycle, and it ends when we decide to actively incorporate youth voice. When youth are granted a seat at the table, it tells us a couple of things. 1, you're taking our thoughts and opinions seriously, which is a great start. 2, you actually care about whether or not the programs you're executing will benefit the youth you serve. 3, we are in control and of our treatment. And 4, we can be the change we wish to see in the world. These positive messages empower youth to share their thoughts and experiences and their real feelings. With the feedback coming directly from the source, you're able to improve programs and make them more accessible to the youth you serve. The next advice I have in regards to action steps involve looking around at your work environment and asking yourself a few questions. Next slide, please. Are you actively incorporating youth voice in your work? The first step is analyzing the examples you already have. Do you incorporate youth voice in your current work? If so, how and in what ways? Do you find that there's a general disconnect between what the youth are asking for and what your organization is providing? 2, do you know the needs of the youth you serve? The next step is asking yourself the critical question before you begin making any changes. Have you spoken to the youth you serve and about their needs? If so, how long ago? In what form? How many youth were able to contribute? Many organizations may find that they think their youth need and what their youth are actually saying they need are two separate things. This is because we need to operate on out-of-date information. I know gathering information from youth can be like herding cats, but it's important to take a step in building an authentic relationship with them. We're running a little low on time, so I'm gonna try to power through. So I'm gonna skip down, but I'll make sure that these slides are available to you so that you can find all these questions. I'm gonna skip down to question 9. Do you have indicators in your office that all identities are welcome there? Adding flags that represent the LGBTQ plus community in your main office was one of the first things we did when we began implementing this work at the Department of Social Services. And it was a complete success. LGBTQ plus youth would tell us how excited they were to see their flags, how it led to even more referrals from our support group program. And the same can be said for your organization. When you see these signifiers, they're more likely to disclose to you, which can lead to you referring them to programs or just shaping their care plans to match their needs and improving their experience. And then 10, do your intake forms create room for your youth to share their pronouns, chosen names, or sexuality? Another thing we found successful when implementing this work was collaborating with our stakeholders to collect information about our youth identities via routine paperwork. Youth fill out so many forms throughout their time in the system, as well as in different programs, that the department offers, and we found none of these forms had any information about their sexual orientation or their gender identity. This way, if they didn't receive, I skipped a part. Okay. This way, if they didn't feel comfortable disclosing their social worker or their foster parent, they still found a way to receive the tailored care they deserved. This also made it easier for us to know just how many LGBTQ plus youth we had in care.
Nakaya, you are so amazing, and I really don't want to cut you off. I'm so sorry. We are definitely going to bring you back for a much longer presentation to the entire state. I'm going to ask you to say like 30 seconds to close out because we have to have our staff open up the next set of rooms. I'm so sorry.
No, I understand completely. I'm so sorry for running over. Thank you all so much for having me. And thank you all so much for this opportunity. And thank you for attending this conference. I believe that you now have so much hope and that that hope can be given to the youth that you serve and that you will continue pushing the cycle forward and breaking down the barriers. Thank you so much.
Nakaya, you are amazing. Oh my goodness. And I hope that you check out this chat log and we will give it to you as well. Thank you, thank you, thank you. Un mil gracias. There's no way to say thank you enough. And we're going to hopefully bring you back if you would come back to us again. So thank you for everything. And I just want to acknowledge for everyone here the amount of emotional labor that it takes to share one's personal story in this kind of way, and that we honor Nakaya and that kind of intelligence and emotional labor that they have brought to us and to everyone else for the rest of this day. Thank you, Nakaya, so much. Thank you all. Take a break. Come back to your next session, please, through Socio at 11 a.m. Thank you so much. Take good care, everyone.